As you may already know, I'm passionate in helping non-US IMG to match to residency program in the US. However, I matched in 2017 and graduated in 2020 and has been working as attending physician for 3.5 years. So there are so many things have changed since then. Step 1 has become pass and fail. COVID came and interviews changed into virtual interviews. There are program signaling. USC has become more competitive for non-US IMG. So in order for me to help non-US IMG to match, it's only right if I re-educate myself of these differences and the common struggles that non-US IMG face in order to match to residency in the US. And that is why I bring out guest speaker today, Dr. Ujjwal Soni, who has successfully matched to internal medicine in 2024 cycle. He is also a YouTuber who has more than 2,000 subscribers, and his videos has helped a lot of non-US IMG. Dr. Ujjwal Soni will give us some insights about how to study for USMLE, his USCE experience, his opinions about research, and tips and tricks in interviews, and many more. So here I present to you Dr. Ujjwal Soni. First of all, thank you. Thank you so much for accepting my invitations. Really, really appreciate it.
The pleasure is all mine, Dr. Haryadi. Thank you for having me here.
I think we start with introducing ourselves. I will introduce myself, and then after that, you can introduce yourself, right? I'm Yulius Haryadi. I'm non-US IMG from Indonesia. I graduated my internal medicine residency in 2020 at St. Francis Hospital, Evanston. I'm in New Hampshire right now. I work at both outpatient and inpatient. I think I'm the only one that work actually both because I want to maintain my hospitalist skills a little bit. So, but primarily I'm outpatient at Wentworth Douglas. That was Wentworth Health Partners, and then I work at Wentworth Douglas Hospital for my inpatient stuff. So we are a subsidiary of Mass General Brigham and Massachusetts General Hospital. It's part of the big group. I'm very, very lucky to be able to work at Wentworth Douglas. Actually, it's really a good place to work. Amazing place. I have been very passionate in helping non-US IMG like me. Put on LinkedIn. Actually, you're the first person that I messaged in LinkedIn. And I was quite surprised how humble you are and then respond to me. And I was really happy that we can connect and then talk now. So really, really appreciate it again. So I made contents in YouTube, post LinkedIn. Everything is related to help non-US IMG. So this interview is basically, because the way I did residency before and how we can match the internal medicine now will be different. I did it before COVID, before the signaling. So many things has changed. So it will be a really good insights to hear it from somebody who has successfully matched internal medicine recently in 2024. So that's why I invite you. So yeah, can you introduce yourself, Dr. Soni?
Yeah, thank you, Dr. Haryadi. First of all, thank you so much for having me here. My name is Ujjwal Soni. I'm a recent graduate from University College of Medical Sciences, New Delhi, India. I'm a non-US IMG, and I just managed to match at University of Oklahoma in internal medicine. So I'm the incoming PGY1. I'll be starting in July this year. I started with this journey 2 years ago after graduating from my med school. Over the course of this journey, I started making YouTube videos, mostly to enhance my communication skills and also,
get
comfortable
I heard that.
with the
You
idea
mentioned
of
that in your video. Yeah.
Yeah. I'm glad I could help a lot of people throughout through my YouTube videos. So yeah, that is how it started, and here we are.
Great. I think the thing why people like about you is because you are authentic and very genuine. So people can connect with you easily, which is what I really like about your channel. So I did follow your channel. I watch, I think, if not all, most of your videos. Maybe there's 1 or 2 videos that I didn't watch, but I think I watched almost all of them. So those are very good video and very, very valuable. So no wonder people really appreciate your work. So thank you so much. We'll discuss a couple things today to help our non-US IMG friends. I think the core of getting matched, we can summarize into the USMLE, the USCE, and the research and interview. Probably talk a little bit on that interview. So we're gonna go pretty much in that order. So for the USMLE, we're gonna start with step 1. What do you think a lot of non-US IMG struggle with when they preparing for the USMLE?
I mean, if you are just talking about step 1, like since it has become pass fail now, I saw some statistics that the pass rates have gone down as compared to when it is score. Yeah. So I think people are taking it lightly just because they are trying to just pass and not score well, since it's not scored, right? But I feel, at least for non-US IMGs, take step one as if it was still scored, because your basics of step one will really help you score better in step two as well as step three. Plus, you cannot take any chances if you're not preparing well for it. And if by chance you get an attempt and you get a fail in your first attempt, step one, that is gonna decrease your chances of matching exponentially. Just my first advice would be to just take it as well as you can, consider it to be scored in your own head, and make your own short notes. That would really help you in your step two and step three.
Do you have some recommended resources for step one? What do you usually recommend people? Because again,
Well,
the result is so different than how I did it last
yeah,
time. I mean, I used
I
Kaplan,
think
but there was no boards and
yeah,
beyond before. So I would want to hear it from you.
the primary gold resource for step one has always been first aid, and it has been going on. I consider it to be the holy grail of USMLE. Obviously, first aid should be your primary resource, and UWorld. Those two are your prime should be your primary resources. That is what I used. I supplemented first aid for certain units with boards and beyonds or other videos if I could not understand something. Like for cardiovascular system, I forgot key concepts, so I supplemented with boards and beyonds. But the main part here is whatever you are supplementing, put it all down into one resource. If you're doing something extra and you get some extra important information, put it down into your one primary resource. I use first aid. It could be anything else for your own, but the main point here is that you keep all your information concise at one place. But in the end, when you start revising stuff, you don't have to, go through 10 different books. So that really helps in the end when you start revising stuff.
Excellent. Now, I have questions from a student most recently. I would like to know your opinion. The student struggle with studying USMLE Step 1. He mentioned that, oh, for some reason, I cannot really retain the information well because I study cardio and then next time I study the renal and then after that I study biochemistry. But afterward, I forgot the things that I learned from cardio and then I keep getting low score. What would you recommend to that type of student that struggle with that?
Well, absolutely. This is the problem I have heard from most people. And this
Like,
is a problem even I struggled with initially when I started my preparation. Interestingly, I also made a video on this one. What I followed and what I devised over time working through the world was, so I also named it I named it basket strategy. So what I do is, you suppose you want to start with cardiovascular system, right? Let's focus on step one. So I would read the cardiovascular system from first aid, get to know the basics and everything that I have learned. I would take 2 3 days to read all of it, and then I would do one block of UWorld in time mode, study mode, not the exam mode. I just studied something, and I would test my knowledge with 40 questions, one block of UWorld. Mostly, one block would give you enough confidence that okay, you just read something and you can solve these questions decently. If not, solve two blocks of the same unit. That's it. Keep it aside. Go to renal. Do the same thing for renal, right? Read renal entire unit, then solve one or two blocks on time mode in study mode, not the exam mode, and get confident in that. Then combine the both the units and solve one block of both the units together in timed exam mode. That way, you are just combining. You just read 2 units, you combine them, and now you're solving them together. Keep both the units aside. Do it for the another unit. Let's take it CVS. Do the same thing for that. Read it, solve one or two blocks in timed study mode, and then do the combined 3 units together. That way, by the time you reach 25 or 30% of UWorld, you will be carrying your entire syllabus together. You'll be forming connections between different units, and you won't be forgetting CVS because you're solving one or two questions of each unit every day, right? You will be going back to the unit again and again. This is one strategy that I used. Consider units as fruits. You're putting fruits in the basket one by one, and then carrying the entire basket with you till the end of the syllabus. That really helped me. Once you're done with the syllabus, I went through the entire notes that I made or the entire first that I had annotated, and I made some quick short notes or everything so that I can revise in last 1 week. Mind maps to quickly summarize everything in very 1 or 2 pages. So that really helped me in the end when I could revise everything.
I actually watched your video about that one, so I know actually exactly your method. And as I mentioned also in my other videos, see, you have a method, I have a method, but the fundamental principle doesn't change. I actually do the same method, just how you do it. The little
Yeah.
bit difference is, no, actually, I pretty much do the same method. So
Yeah.
you build your concepts, like you build your knowledge, you test yourself, and then you go for
Mhm.
another test
Yeah.
that one and then both, and then move on and move on, and then you revise at the end, and you use the mind maps, which is a form of active learning, which
Right.
you
Yeah.
don't now the a lot of mistake a student makes is they revise. Okay, I'm gonna revise. They're gonna open the book and they start reading. Now
Yeah.
that's
Yeah.
really an alpha way to
Uh-huh.
revise. You revise in a way that's very active. So see, the fundamental
Yeah.
concept, it stays the same for learning, regardless of who you are. If you get high score,
Yeah.
perfect, great. So we move on to the step 2 CK. You have something addition for step 2 CK. What are the non-US IMG maybe struggle with for the step 2 CK?
Well, very similar to step one. Like I said,
Similar. Okay.
some people struggle with step two is when they do not have good concepts with their step one.
Right.
Because steps two is essentially you make the diagnosis in your head and then you select what is the next best step or how will you manage the patient, right? But for that to select the correct answer, you should make the correct diagnosis first.
True.
That comes with step one knowledge, right? And similarly, like step two is very memory heavy because you have to remember a lot of algorithms, right? A lot of guidelines. If you're making quick point maps, it should really help you to revise in the end. For step two, there is no good resource. I mean, first aid is gold standard for step one, but step first aid for step two is not really considered a good resource. A lot of people struggle with they just have UWorld to solve it, which is an excellent resource. A lot of people want to read something and then solve UWorld, right? They don't want to directly solve questions and then make their concepts. My only suggestion is that there are a couple of UWorld notes available online on Reddit and Telegram. Maybe you should consider using them and treat them as your first step for step two, and then keep on annotating them as you solve your world. And in the end, again, you make your mind map or you make your own podcast, very similar to step one.
Excellent. Okay, so those are the USMLE. Hi, we're getting back to the video in just a moment, but I would like to give you a gift for watching this video. I like to give you access for free on-demand video training of my USMLE test taking strategies that I have originally created myself after more than 3,000 hours of tutoring USMLE. This video is packed with how to read questions effectively, elimination strategies, 50-50 strategies, and time management strategies. This is the method that I use to get 258 and 261 in step 1 and step 2 CK. It's all in here and it's free. I want you to watch it because it is the test taking strategies method that I believe in. So watch it, take notes, apply it so you can achieve the high USMLE score that you dream of a free video training. Just go to juliusharyadi.com/USMLE test taking strategies. Again, that's juliusharyadi.com/USMLE test taking strategies. Now let's get back to the video. Among of these steps, USMLE, USCE, research, and interview, which one do you think is the most challenging?
Okay, that's a good question. Step two, okay, I would say most challenging.
More
Step two
challenging
is
than USCE or research or the interview itself.
I'm not able to compare them because these are like it would be comparing oranges to apples.
Yeah.
So all of these are very challenging in their own ways. For step two, and for the instance, I mean, you can just take that exam once, right? And it's gonna be scored. And whatever score you have, that will stick with you for 7 years. So that is essentially
High
your life, right?
stakes.
You won't,
High stakes. Yeah,
yeah,
yeah.
exactly.
I
And
remember I was like, I have functional dyspepsia. So if I'm very nervous, I will be very nauseated and I'll be vomiting. I vomit the day before I took my step one because step one that time was 3-digit score. And like you said, you carry
yeah,
on the rest of your life, right? I can't screw up.
yeah,
This is it, like, you
exactly.
have only one chance. So I get what you mean. Yeah, yeah. So you think the step
Mhm.
two CK, because that's 3-digit score carry, that's high stakes.
Exactly. It's a very high stakes exam. I carried propanol in my exam, for performance anxiety. Didn't take it, but I did carry it because I was very nervous before my exam. But yeah, so it's a very high stakes exam. For US clinical experience, I mean, it's very difficult to, get US clinical experiences these days. And a lot of agencies have popped up, offering paid rotations, paid letter of recommendations, trying to scam a lot of people, a lot of naive, desperate non-US IMGs, who have no knowledge of the system and who do not know what is the value of a paid LOR or if they would derive any value out of those rotations by paying thousands of dollars, right? So yeah, I mean that is another challenge trying yourself to get good observerships, and then preventing yourself from getting scammed. Interviews is another struggle in its own. The whole journey is a struggle.
The struggle, yeah. So
Yeah.
let's talk a little bit about the USCE. What would your recommendations for non-US IMG to get a good, high quality USCE?
My primary advice would be to avoid agencies at all costs. If you can, start scouting for these opportunities very early on. Start at least 7 to 8 months before your intended time of visit, and then try to get your observerships from good hospitals. There are some good ones like Cleveland Clinic, Mayo. They start their application very early on. Start scouting for them. Look out for them when their application opens. Try to apply to places which have a good IMG friendly residency program. That really helps to get an interview because they already know you. If you perform well, they like you, right?
Agree.
You are gonna get opportunities to network with people in the program, the residents, the program director, maybe the APDs, the professors, attendings. So that way you are not an unknown applicant to them. They know you. People can vouch for your application. If you work at 4 different hospitals and they have an IMG friendly residency program, you can hope to secure at least 1 or 2 interviews out of that. And each interview counts in the end. Each interview is very important in the end, right? Avoid agencies. People usually know, I mean, program directors are not stupid, right? They're getting hundreds of applications, and then they see that they're getting LOR from one particular person and, similar written LORs from this particular person. I have seen a lot of PDs openly discuss about it, that they know what an actual letter of recommendation is and what is a generic paid one. They can differentiate very well. They have been doing this for years. Try to avoid agencies, go to authentic programs, authentic hospitals.
Right. Now, I think I watch your videos. I can't really remember. You correct me if I'm wrong. Did you do most of them as observerships, or was there a hands-on one that you did?
I was already a graduate when I started preparing for
Right.
USMLE, so I could not do any clinical electives. I had 6 US clinical experiences. 5 of them were observerships, mostly at big hospitals or university programs or IMG friendly programs.
Right.
One was a hands-on externship in a clinic, which I got through my father's colleague. Honestly, I'm being very honest about it. So yeah, I had a contact and I got it through that.
Excellent. Okay. So got it. Now, let's talk a little bit more when you do that's how we get the USCE, right? That's the problem. But do you have some recommendations on when you are doing the USCE, when you perform? Do you have some basic tips that you can give for the observers so they can perform well and get that recommendations?
Definitely. So, have good basics of concepts. So when you go there, you want to attend the rounds, room with the residents, the attending. So they're going to ask you questions, or they will encourage you to ask them questions. So have a baseline knowledge. So I suggest people to go after their step 1 or step 2, so they have their baseline concepts in their mind, so that they can ask intelligent questions. Be on time, dress well, smell nice, right? Have good communication skills, learn, observe the room. Do not compete with anyone. Be nice to everybody. Do not be rude to anyone, right? No matter how small or big that person is in the team. Treat everybody with respect and treat everybody equal. Be very cautious with patient interactions. That is really important. Other than that, just immerse yourself in the environment, attend daily rounds, noon conferences that happens at most places. Right? Try to show your efforts. Ask your attending good questions. Ask them if they would like you to prepare a talk on something. Try taking up cases. Even if you're an observer, you can still take up cases with the help of your resident. Right? You're not directly involved in patient care. You're just shadowing your resident, and then you're taking up the case and presenting to your attendant. That really shows your effort, and that really can get you good letter of recommendations.
Okay. Pass, fail, or 3-digit score?
3-digit score.
3-digit score.
Yeah,
so
definitely.
You prefer like step 1 to be a 3-digit score rather than a pass fail?
Of course.
Inpatient observership or outpatient but hands-on?
Both, if you can.
If you can only choose one.